starting off with the superficial head of the masseter attached to the zygoma and mandible. Then we can remove it to look at the deep head of the masseter attached to the zygomatic process of the temporal bone and the angle of the mandible. We're going to remove this so we can better see all of the temporalis muscle. The temporalis muscle is attached into the temporal fossa via the temporal fascia that is attached to the frontal, parietal, and temporal bones. By removing the zygoma and the temporal bone, we can see where the temporalis muscle attaches to the coronoid process of the mandible. Once we remove the temporalis muscle, we can start to see one of the deeper muscles of mastication called the lateral pterygoid muscle. Both the heads of this muscle are attached to different regions of the lateral pterygoid plate of the sphenoid bone. After the two heads join together, they attach to the inner part of the condyle of the mandible and the articular disc of the temporomandibular joint. In order to see the deepest and least accessible of the muscles of mastication, we will have to rotate the head around so we can look from the underside and from the back of the mandible. This is the medial pterygoid muscle. It also has two heads, but only one of those heads comes from the medial surface of the pterygoid plate of the sphenoid bone. The other head attaches to the palatine bone. Once these heads come together, they attach to the inner part of the ramus of the mandible, not inferior enough to attach to the angle of the mandible. The muscles of mastication are mirror images of each other on both sides of the mandible. If one side is working harder than the other, there will be an imbalance, which can lead to pain and dysfunction.